When's Harlow going to get a new hospital?
Well, I've been talking today to the bosses of the Princess Alexandra about the proposals for a new hospital. Now we're making improvements in the meantime. A new ward opened last month, and there's money ready to improve the A&E facilities. But you know, this is a 1950s hospital, and we're now in the 21st century. So we'll look very seriously at the proposals when they're brought forward.
But you look at different hospitals around the country. Some must have a better case than others. Harlow has a better case than others?
Harlow's got a good case. The levels of the amount of space that there is in some of the most critical areas is really, really tight. I'm incredibly impressed with how much the staff are managing to do in the current facilities, but you can also see the case for an improvement especially in some of the wards.
Timescale at all?
Well, I'm looking forward to the proposals coming forward from the hospital. They haven't quite signed off exactly what the proposal's going to be, but they're doing a lot of work on it right now. So I look forward to that, and then when it comes to my desk, we'll have a good look at it.
Robert Halford, does this mean we're a step closer to getting a new hospital because the minister's come?
We are a step closer. I liken it. We've got the car in the drive, but the door's not yet quite open. We've got a lot of work to do. I've been working incredibly hard. I've had 3 debates in the House of Commons. We've had 2 visits from the previous Health Secretary. I've managed to get the new Health Secretary at Hancock here today to make the case. He's been all around the hospital, seeing that although we have outstanding staff here, incredible service to patients, really wonderful people. He sat with the boards here, he sat with nurses and doctors, because obviously he's been around to see we have to have a new hospital that's fit for the 21st century.
And what was the message that that the nurses and Lance McCarthy, what message were they imploring as well?
All of them, every single person in this hospital knows that we need a new health campus fit for the 21st century, and they were lobbying hard. He was even taken into the basement to see the crumbling infrastructure underneath the hospital. And we're very lucky the government gave us $9.5 million just before Christmas, something I've been working hard, lobbying hard for. But that is really an elastoplast. So it's incredibly important, really welcome. It will last for a while. But we need a new hospital fit.
Lance McCarthy, positive visit from Matt Hancock?
Absolutely fantastic for Matt Hancock to come and see the hospital. He spent a long time talking to all staff across the organisation. We had an opportunity to talk to him about the new plans for the new hospital, and we got to show him some of the fantastic care that we're providing.
I think my first question to him was, when are we going to get a new hospital? Does this mean we're a step closer?
So his visit doesn't necessarily mean we're a step closer, but we're continuing to work really hard in the background. We've got a very clear process with the regulators, with the NHS Improvement and NHS England. As you'll be aware, we're making a decision, our board meeting on the 7th of March about the preferred site, and then following that, all the relevant formal paperwork can continue.
In your meeting with him and showing around the hospital, was there anything you were able to highlight? What was the most important things you really wanted to highlight?
So we spoke to Matt Hancock about a whole range of issues. Obviously, we spent a long time talking about our need for a new hospital and the reasons for that. But we also had the opportunity to tell him about some of the significant improvements in care that we're providing through urgent care, some of the integrated care partnership work that we're doing with all of our local health and care partners, how we're transforming care in a range of different services for all of our patients. And an opportunity to talk to him about some of our innovative workforce plans. So a really, really good, broad, wide discussion.